Hello and welcome to Health Services 411, a program designed to keep you updated, informed, and educated about activities, events, and policies of the BVI Health Services Authority. I'm your host, Marketing and Communications Manager, Natasha Ledsam.
Hello, for today's 411, we're here at an Autism Spectrum workshop here. We're about to learn some interesting things about autism and its impact in the territory. We're here with Dr. Renee Beaumont. Ms. Beaumont, tell us a little bit about yourself as it relates to autism awareness.
Thank you. So I originally did my PhD in clinical psychology at the University of Queensland and creating a gaming-based social skills program for kids on the autism spectrum. And since then, I've really followed my passion in kind of advocating and supporting kids on the autism spectrum as well as teens and young adults in a range of different contexts. So both in school settings, working with young people in private practice, through the hospital setting, and most recently I've been involved in a large trial at Weill Cornell Medicine, New York Presbyterian Hospital, where I've relocated to kind of look at the use of technology in empowering and supporting youth, both on the autism spectrum, but with other conditions as well.
Okay. Now, we know that you're a facilitator for this workshop today. Tell us a bit about the workshop and some of its objectives.
Yeah, I mean, the workshop has a range of different objectives. So firstly, trying to increase awareness and understanding of autism spectrum conditions and also the strengths associated with individuals on the autism spectrum, as well as some of the challenges that they face. The attendees are also learning about what screening tools they might be able to use and what treatments really does the research show work for individuals on the autism spectrum. And then now we're about to take a deep dive into the Secret Agent Society computer game, which I created to teach kids how to recognize and manage emotions in themselves and others, and how to navigate some of the social challenges they face. So yeah, the participants are about to kind of launch into the computer game and have some fun and see how they can use it with the families they support.
Awesome. Now tell us a bit about autism and how it's classified.
Yeah, I mean, there's a lot of debate about the classification of autism. Not so long ago, about 5 years ago, the diagnostic criteria for autism changed in the Diagnostic and Statistical Manual for mental health conditions or disorders. And so at present, the recommended process for diagnosing autism involves a very comprehensive assessment, information from many parties, from parents, from teachers, from the involvement of speech pathologists, occupational therapists, psychologists, and also observing the child themselves to get a really good picture about what are the challenges that child's facing in terms of the area of social communication, connecting with others, being able to kind of take others' perspectives and recognize how they're feeling. And then also part of that diagnostic process is understanding if the child has any repetitive behaviors like hand flapping, rocking, or specific interests that really capture their attention and focus. And through a comprehensive assessment of those two main areas, we can see, does the child really meet the criteria, and what's going to be the best support for that individual child that's tailored to their unique needs.
Mm-hmm. And how does a child with autism look in terms of some of the signs and characteristics they exhibit?
Yeah, absolutely. I mean, it depends on the age of the child. Some of the early signs may be, a parent pointing for them to look at a certain thing and the child not following, or the child not showing a lot of interest in wanting to share their interest or engagement in a particular activity or toy with a parent. Mm-hmm. As the child starts to get older, there can be issues in terms of turn taking in conversation, some difficulties with, understanding the role of friendship and what a friend really is, and how do you establish and maintain friendships. As well as some differences in how they express emotion. There may be some issues with them not expressing a lot of emotion or over expressing it, and not being able to read clues or cues in other people that show how they're feeling, and knowing how to respond appropriately.
Well, awesome information. As we continue, share with us some insight into treatment and also how this workshop is intended to impact the treatment of children moving forward.
Absolutely. So, I mean, the treatment space for autism, there's been an explosion of research and interest in this in recent years. Previously, it was mainly just young kids that we knew what worked. And parent skills training is very, very important in being able to train parents in how to engage their child in social interaction, how to reward them and motivate them to socialise with others and learn these critical skills they need for life. As the child gets older, there's also some individual therapeutic approaches that research shows work really well. So one is cognitive behaviour therapy, teaching kids how to think in more helpful ways and stay calm to approach challenges. This particular workshop, we're really harnessing the power of technology. So a lot of kids on the autism spectrum love technology, and so we want to use that interest and strength to kind of help them understand the social world around them and to be able to generalise and apply the skills from the computer game to everyday life to improve their peer socialisation skills and their ability to manage their emotions.
Awesome. What exactly is the impact of autism, and is it gender specific?
In terms of the impact, it really is different for different kids. So we've got level 1, level 2, level 3. It's a spectrum. And even within those levels of severity, the impact can be different for different children. But often some of the impacts are, a limited ability to socially connect with others. And then in teen years, often that can translate into issues then with depression or low mood, when they often really want to get along with their peers and create those teen relationships that are so important at that point in their life. So being unable to do that or being restricted in their ability to do that can lead to secondary issues with depression or anxiety, particularly during the teenage years. And then as they progress into sort of adulthood, sometimes these challenges in understanding the social emotional world can really restrict their ability to get gainful employment, to pursue college degree, to really achieve their potential. So that's why interventions like this are so important, to help them overcome those challenges and kind of harness their strengths to achieve their goals.
And what about other behaviors, social behaviors like ADHD? Is autism linked to that?
Yeah, I mean, the research does show that a lot of individuals on the autism, not all, but a lot do also have challenges like ADHD. Also, anxiety disorders are very, very common. And we're still trying to understand from a research perspective what the links are. I mean, some of the symptoms of those conditions sort of overlap, and teasing that apart to understand, well, what's unique to the autism versus the anxiety versus the ADHD is really where we're at in research at the moment.
Mm-hmm. And is there anything that, prospective parents can do to reduce their chances of their children having autism?
Well, at this stage, I mean, there is a genetic component to autism. I think the key thing is if parents do notice early warning signs that their child's struggling a little bit with that social connectedness, it's very important they seek help early. So they speak to their primary care provider, their school, to find out, can we look at this and see if there is a real challenge here? Because the key to the best outcome for individuals on the autism spectrum is early diagnosis and early support and appropriately tailored intervention.
Awesome. One more thing that I have to ask you, you know that there has been a lot of information circulating regarding vaccinations and it's linked to autism. Can you speak a bit about that?
Yeah, I mean, I certainly understand the fears that parents have. You've got this beautiful little person that you've brought into the world and you want the best for them. And the fear that vaccination may somehow increase the chance of your child developing this condition. At this point, the research does not support that there's a link between vaccination and autism. There often is sort of this parallel or kind of concordance in age, though. The age at which kids get vaccinated is also the age that some of these symptoms of autism become apparent. And so sometimes it can appear that there's a link between the two when in actual fact, it's just that both these events are often happening around the same age.
I want to thank you for coming on the program today and sharing with us this very beneficial information regarding autism. I'll allow you this opportunity to make final thoughts.
Thank you. I think in terms of final thoughts, I think parents sometimes when they hear or receive the news that their child has an autism spectrum condition, there can be a great sense of grief or sense of loss that their child can no longer achieve their dreams or the potential that the parent had hoped. And I guess my final message would be for parents to kind of see the strengths that kids on the spectrum can have, and know that, you know, so many professionals in this area are really passionate about doing everything they can to create new interventions and supports to help their kids to reach their potential.
Thank you very much.
Thanks so much.
Thank you for tuning in to today's 411, where today we were at an autism workshop, and today we learned a lot of information regarding autism spectrum, its impact and treatment. Reporting for the BVI HSA, I am Marketing and Communications Manager Natasha Letson. Thank you for tuning in.
Thank you for tuning in to this edition of Health Services 411. Please like and share this video and follow us at the pages below as we seek to improve the pulse of the people of the territory. Until next time, remember, your health is your wealth. Reporting for the BVI Health Services Authority, I am Marketing and Communications Manager Natasha Letson.